Hi, I'm Dr. Melanie Mayberry, and I'm a full-time faculty member at the University of Detroit Mercy School of Dentistry. I'm a clinical associate professor and the division head of Practice Essentials and Interprofessional Education. And I am running for delegate for the Michigan Dental Association to the American Dental Association, and I would appreciate your vote. There are two questions that we were given as delegates to answer. One was, what strategies would I use to get resolutions passed? And two, what reference committee would I be interested in? I would be interested, I'm going to take the reference committee question first. I would be interested in reference committee D. I served on reference committee D last year as a delegate, and I enjoyed it. I enjoyed the experience. I thought it was a good fit for me. I like the interface of medicine to dentistry. That's part of my official role at Detroit Mercy, and that's also my personal interest is interprofessional education and collaborative care, so I think it's a great fit. I'm also interested in legislation and policy and advocacy, and those are all of the things that Reference Committee D does. And so for that reason, I would choose to participate with Reference Committee D. The other question that we were asked to answer was, what strategies would I use to get resolutions passed? And I spoke earlier in terms of collaborating before the meeting or networking during the meeting, or just waiting to hear what the testimony is on a particular issue. I think all of those have value, but the one that I would prefer is to collaborate with people before the meeting. Collaborating before the meeting gives me an opportunity to understand why someone may feel exactly the way I feel, and I may not have considered a particular perspective. It also gives me an opportunity to learn why someone might feel different than how I feel, or what I'm proposing, or what I'm advocating. And so having that time to collaborate before the meeting gives me an opportunity to research those different arguments or components or aspects of a given issue that we're trying to pass. And so for that reason, I like collaborating ahead of time. I think it gives me an opportunity to research a little bit more, gives me an opportunity to strengthen my argument. It gives me an opportunity to learn why someone might feel a different way, and helps me be sensitive to other issues that I may or may not have considered. So for that reason, I would choose collaborating before the meeting. Again, I'm Dr. Melanie Mayberry. I look forward to meeting you at the Michigan Dental Association in Grand Rapids, and I hope I can count on you for your vote. Thank you for your time.